Laser vision correction is today one of the safest surgeries that is available. When patients have been asked after laser vision correction as to what was their experience and whether they took the right decision to get laser vision correction done, an overwhelming number of near 98 to 99% of the patients have reaffirmed their faith in laser vision corrections. Some of the side effects that can happen after laser vision correction could include transient dry eye. Normally, a patient can feel that the lubrication is slightly less, or the patient may have symptoms of grittiness, etc., which are because of tear film instability. These tend to settle down in a couple of weeks, and as a normal routine, we do give artificial tears, tear lubricant, and cyclosporin eye drops to patients post laser vision correction. So this is something which is transient, and the dry eye normally does not continue more than a couple of weeks. Apart from that, there could be some amount of patient having an undercorrection or a regression. That means that the effect of the laser may not be achieved to the entire accuracy in 100% of the cases. This could be depending on the power or the starting initial refractive error that a patient may have and the type of laser that you have used. Let us understand that it is human corneal tissue that we are ablating or taking out a lenticule, and each tissue can behave slightly differently as regards the effect of the laser and also as regards whether there is the healing process which could be different between patients. So regression, if at all it happens, or if there is an undercorrection, can be easily recorrected after achieving stability. Usually the number of patients who require recorrection is below 2 to 3%. That means that majority of the patients, a very significant majority of the patients, do not need recorrection or having to do a redo. When we do these procedures, if a person requires recorrection, we normally include it in the package that is given, and the patient can get the recorrection done. Another side effect that a patient may have in the initial period is night glare and halos. This usually happens if the pupils are too large or if the patient is having a very high refractive power. Therefore, patients with more than -8 or -10 power are nowadays not corrected by laser vision correction, but instead go in for the phakic implant, and the night glare and halos problem is therefore under control. Having a larger optical zone from where you are treating the laser vision correction reduces the amount of night vision problems. Indian pupils or Indian iris are normally darkly pigmented and they don't tend to dilate too much at night, and therefore the incidence of glare and halos is also tending to be less in Indian patients as compared to lightly pigmented irises that are seen in foreign patients. Any complication which can lead to the reduction in the quantity of vision which cannot be corrected would be less than 1 to 3 per 10,000 eyes, that is less than 0.001 to 0.003% in good quality centers. Overall, to re-emphasize, LASIK laser vision correction is one of the most satisfying and one of the most stable procedures that is done on any part of the body with excellent, exceptional outcomes.
Follow Planet LASIK and post your queries to get answers from the experts.